I'm Dr. Nick with Fairway Chiropractic, and I want to explain to you what spinal decompression therapy is and how it works. So this is called a SpineMed spinal decompression therapy with somebody who's set up on it right now for a lower back injury. We can actually also use it for a neck problem with an apparatus that's sort of hidden behind this computer. So what does it do is what I want to primarily explain. So imagine my fists are two bones in your back and what this table does is for 60 seconds, it will gently decompress or traction the bones in your lower back. And for 30 seconds, it will slowly let them relax again. It'll just repeat that motion for a period of 30 minutes while you're on the table. And ultimately, the purpose of that is that most people this will help with is people who have disc herniations. And a disc herniation is when that jelly center of the disc sort of pushes out through the outer wall. And by doing this gentle motion back and forth, it's sort of like squeezing that tube of toothpaste the right way that the excess toothpaste sort of sucks back in. So it just helps literally suck the disc material back into the center. And the second thing that this table does is that this gentle pumping action actually allows for nutrition or nutrients to actually get into the disc for it to actually heal properly. So that way it sort of closes off that crack in the wall of the disc. So those are the two primary objectives of this table. Now, how it works is that we've got here some clamps that are braced right along the pelvis that you can see, and it is clamped right into from steel to steel, and the motor is right in here. So it is pulling and relaxing. I mean, a slower rate than what my fists are showing, like 60 seconds on, 30 seconds off. And that's how it does that. Now, the other thing it does is we can be specific about what segment or bones in the lower back we want to be putting traction on by changing the angle of the table. So you'll notice it's not quite flat with the rest. We can crank it up quite a lot to capture different bones or discs in the lower back, depending on where the main problem is. So that is how a spinal decompression table works.